Over the past year, has someone you know been exhibiting little but worrisome changes? Many believe that death strikes abruptly when one is old. Actually, though, our bodies may transmit silent signs months or even a year before death arrives. Most of us overlook these symptoms as they begin tiny. Looking back, we see the hints were there all along only later. But by then, it is too late to get ready or to count those last recollections. 5 main indicators that usually show up 1 year before an old person dies will be discussed in this video. Among these might be things you have observed but dismissed as normal aging. Though they look little, others really indicate the slow drop in the physique. Early recognition of these indicators can help you to offer better care, treasure special events, and most importantly, make sure that the last stage of life for your loved one is comfortable, dignified, and peaceful. Stay with us to the very last, since these 5 indicators will equip you both practically and emotionally to get ready for what is ahead. Understanding what is happening can help you not to be surprised. Spending your remaining time with loved ones can help you to maximize it. Let us now delve right in. Number 1. Unintentional weight loss is among the first and most striking indicators someone could be nearing their last year of life. It might first be so subtle you hardly notice. Perhaps a belt that needs tightening, clothes that begin to hang a bit looser, or an appetite that just seems a little weaker than it was. Although many families write this off as a natural aspect of aging, the fact is that losing weight without trying is hardly a positive indication. Often, an indication the body is trying to adequately absorb nutrients is an unexpected weight loss. Muscle mass is declining, and important processes are slowing down as well. Although aging normally causes some muscle loss, if this occurs too rapidly, it may indicate something more sinister is happening. The body could not be absorbing food as it ought or might not be able to effectively break down protein, which would cause muscle loss. This decline of power goes beyond appearances. It makes walking more difficult, raises the likelihood of falls, compromises the immune system, and renders the individual susceptible to diseases. Sometimes changes in appetite lead to weight reduction. Older folks can just lose interest in food. Their taste disappears, food might not look as good, and they begin to skip meals or consume far lesser amounts. This is a physiological shift not only of taste. Sensing it starting to fail, the body stops sending the brain messages to hunt food as frequently. The outcome is decreased vitality, decreased strength, and a slow deterioration in general wellness. Then, underlying medical issues exist. Common in chronic diseases include renal disease, heart failure, or cancer is weight loss. These disorders can advance decades before more evident symptoms manifest themselves. Reduced eating from even disorders like depression or cognitive loss can set off a loop whereby the body lacks the food it needs. You may now attempt to inspire your loved one to eat more, provide their preferred meals, or even provide protein drinks. However, if the weight keeps declining in spite of these initiatives, one should understand that the problem is not just related to eating. Her body is getting ready for a more profound change. Right now, pushing bigger meals might not be beneficial. Rather, emphasizing comfort, offering simple, easily consumed meals and keeping hydrated may help more greatly preserve quality of life. You should take attention if you observe notable weight loss in an aged loved one, particularly if they are eating less, feeling less strong, or finding it difficult to remain active. This goes beyond mere appearance here. The body is imparting a message. Knowing that message now will also enable you to be ready for what is ahead with compassion, clarity, and the capacity to make each last minute matter. Second, number 1. Of the most obvious changes in the year before death is a severe, relentless tiredness that never goes away regardless of rest. It's not only the type of lethargy you get following a demanding day. It's a deep tiredness that renders even routine chores difficult. Rising from bed starts to be difficult. Moving across the room calls some work. Once daily tasks like cooking, getting dressed, or simply having a conversation begin to feel taxing, this is an indication the body is preserving its remaining energy, not alone the outcome of aging. The body starts giving what is most critical top priority when organ function slows down. The heart pumps less effectively, circulation suffers, muscles get less oxygen than they used to. Many older individuals in their last months feel weak, unstable, and unable to keep the same degree of activity they formerly enjoyed for this reason. Still, another important component is metabolic slowing. Though the body is meant to create and use energy, it is diverted as it gets ready for its last phase. The body pays preservation first, not mobility. Your loved one may therefore be sleeping more, snooze more during the day, and find it difficult to stay awake for extended lengths of time. Some people may even have abrupt energy loss. They may feel good one moment and next totally depleted. The emotional toll of tiredness is maybe the most terrible aspect of this procedure, though. Once proud of their independence, many seniors start to feel ashamed or dissatisfied as they cannot perform as they used to. Not because they don't care, but rather because they just lack the energy anymore. They could retreat from talks, avoid social events, or quit pursuing hobbies. This can set off a cycle of isolation whereby they quit trying completely, therefore hastening their fall. Watching a loved one move from energetic and involved to tired and distant hurts families especially. Although it's tempting to believe they're simply sluggish or should push through it, the truth is pushing activities won't help. Understanding their limitations, allowing them to rest when needed, and making their last days as comfortable as feasible will really count most. A loved one's body is undergoing a significant change if you find they are constantly tired and their condition is not improved by rest. This is the chance to treasure dialogues, design peaceful times, and help them free from expectations. Ultimately, what counts most is not their capacity. That is, their sense of liked, understood, and comfortable. Please comment number 2 below to let me know you're here, if you're still viewing and find these insights worthwhile. And should you not yet subscribe, I advise you to do so and turn on the bell to avoid missing any of our films. Your contribution enables us to keep producing materials that enlightens and motivates you. Let's now discuss. Number 3. One of the most obvious changes a person experiences as they near the end of life is apparent in their attitude, communication, and interactions with others. Someone who was formerly intelligent and involved may find themselves struggling to understand discussions, forgetting things more regularly, or appearing lost in familiar surroundings. Even if they never had memory problems before, they could repeat themselves, forget names, or lose sense of time. Months or even a full year before death, these minute cognitive alterations occur. This is not simply simple amnesia. It's evidence that, like any other organ, the brain depends on a consistent supply of oxygen and nourishment to operate as it ought, but the brain suffers to remain sharp when circulation diminishes and other systems slows down. Though it may be challenging to understand, this change is a crucial indicator of what is happening. Knowing this will enable you to provide your loved one patience and support, thereby ensuring she feels cared for at these times. Cognitive ability starts to drop when oxygen availability to the brain falls. The individual could find it difficult to make judgments, become confused quickly, or even struggle to identify people or locations they know from years past. Sometimes individuals may experience brief flashes of lucidity, followed by nearly instantaneous bewilderment, as if their mind is flickering in and out. Though they are physically present, it might feel like seeing them gently fade away. Emotional disengagement is another often occurring indication. People approaching death can lose interest in social events. You may find them speaking less, interacting less, or spending extended stretches simply seated in quiet. Their brain is no longer processing emotions and engaging in the same way, not that they lack regard for their loved ones. Conversations grow draining, noisy surroundings become overpowering, and finally, many seniors withdraw into their own world. You could also see changes in behaviour and mood. Some people could get more agitated, nervous, or quickly annoyed. Others may seem especially disconnected, quiet, or apathetic to events that formerly meant anything to them. This is more than just a change of personality. Typically, the brain adjusts to the body's deterioration. Cognitive ability slows down, emotions becoming more difficult to communicate, and the person could cease reacting to events as they previously did. Family members may find this phase very challenging. Seeing a loved one lose contact with reality or emotionally withdraw might seem like losing them before they are gone. Remember, though, that they have no influence over this. Meeting people where they are is the finest thing you can do, rather than attempting to drag them back into talks. Talk softly, reassure them, and know that they can still sense your presence, even if they do not always react. Don't overlook a loved one you find growing more forgetful, confused, or less involved. Often early indicators of the body and mind getting ready for their ultimate change are these. This is the time to be patient, treasure calm times, and concentrate on furnishing a surroundings that seems familiar, safe, and tranquil. Love and comfort remain sensed, even as words fade. Fourth, number one of the most obvious physical signals of the body shutting down is a compromised immune system. Someone who hardly ever became sick previously now appears to catch every cold, flu, or minor ailment that is running about. Simple wounds, like a tiny cut or bruise, heal more slower than normal, and what used to be mild diseases now require far more time to recover from. These adjustments are not haphazard. These are indicators that the body cannot protect and heal itself the way it previously could. One of the main worries here is recurrent infections. When the immune system weakens, skin infections, urinary tract infections, UTIs, even mouth infections are more prevalent. Many families believe these are simply isolated diseases, but often this indicates the body is losing its capacity to fight back when infections start occurring repeatedly or take a long time to clear up. Even formerly fast-acting antibiotics might look less effective. For illnesses that would have been trivial in past years, the person could require more potent drugs, extended recovery times, or more rounds of therapy. This occurs as the body simply does not react to therapy as well as it previously did as circulation slows and organ performance degrades. Chronic wounds are another underappreciated problem. Small scrapes, sores, or bruises that either constantly reopening or show improper healing might point to inadequate circulation. Healing is far slower when blood flow is impaired, as oxygen and nutrients cannot effectively reach skin and tissues. Especially for people who are less mobile, pressure sores constitute a major risk and, if improperly controlled, can cause severe infections. Even more alarming is the fact that infections in the last year of life often do not show the manner we would have expected. An aged person could only look more fatigued than normal, more confused, or less motivated in eating instead of a high temperature. Actually, even before physical symptoms start, for seniors, a rapid drop in mental alertness is typically the first indication of an illness. Early recognition of these changes will greatly affect the degree of comfort and assistance your loved one gets in their last phase of life. Watching a loved one experience recurring infections may be distressing and sad for families. Pushing for harsh treatments is attractive, as one hopes that one more round of antibiotics or one more hospital stay would solve the problem. But at some time, the emphasis usually moves from curing to consoling, more for their well-being than further therapies, making sure they stay hydrated, keep their skin clean and moist, and minimize bodily tension would help. One should understand when comfort should take the stage instead of treatment. Sometimes, the most loving thing you can do at the end of life is ensure them feel as peaceful and as comfortable as they could want. Let's now discuss number 5. And well ventilated, providing cushions or support to assist with breathing and guiding them to keep an upright posture when resting will help to reduce some of the pain. If they find it difficult to breathe, emphasizing their calm and relaxation can help them much. Although supplying little sips of water or deep, slow breathing exercises may assist, it's crucial to avoid pushing anything. Their pulse may also seem to get weaker or more difficult to locate. Their blood pressure may decrease, which would cause them to feel lightheaded or dizzy. The heart would start to beat irregularly. These alterations can suggest that the body is slowing down circulation as it refocuses its efforts toward maintaining the most important organs, including the lungs and heart. The extremities, hands, feet, lips, can feel chilly to the touch as circulation diminishes, and in some cases may seem discoloured, pale, mottled, or blue in tone. This is a normal phase the body is going through. It is not something to worry about. By now, the body is saving its energy and the heart is not pumping blood as efficiently as it once could. For the individual, breathing alterations like irregular patterns or dyspnea could also cause worry. They could be afraid or overwhelmed, but you should reassure them. You may find they have problems collecting their breath, even after a brief chat, or they get breathless after even moderate exercise. Maintaining their calm, providing consoling words, and allowing them to relax as required is quite essential. Should your loved one be going through these changes, the body is almost at the latter phases of life. Though it might be upsetting to witness them struggle with their circulation or breathing, keep in mind that your job is to console and assist. Though in many circumstances the body's natural process cannot be undone, occasionally prescriptions for drugs such painkillers or medicines to aid ease breathing can be written. Being present, reassuring them, and making sure they are as comfortable as they may be is the most crucial things you can do. Early identification of these indicators will enable you to both practically and emotionally get ready for what is ahead. Though it might be challenging to observe, the physical and psychological changes experienced in the last phases of life can be clarified with knowledge. Your job as a caretaker is to make the remaining time as meaningful, pleasant, and serene as feasible for your loved one as well as for yourself. You are not fighting the inevitable here. Should you find these insights worthwhile, remember to comment, subscribe to the channel, and activate the notification bell to prevent missing next videos. We really value your support and enable us to keep offering useful and educational materials. Sometimes, comfort may be much improved with little changes. Some discomfort might be lessened with a humidifier or with little sips of water. In some situations, medications or even oxygen treatment may be utilized to help symptoms pass. Still, the primary emphasis during this period should be on offering comfort rather than trying to solve the problem. You should pay attention if you see symptoms including blue skin tone, chilly hands and feet, or altered breathing patterns. Often these are indicators of the body's energy conservation and slowing down of circulation. Right now, it's important to be there, provide mild comfort, and provide a calm atmosphere where they could feel safe and at peace. Not medical intervention, but comfort, dignity, and the sense that they are not alone will be most valuable in the last months or weeks of life. Think back on everything we covered as we wind up: significant weight loss, acute tiredness, cognitive decline, regular illnesses, and dramatic changes in circulation and breathing are the symptoms that usually show up in the year before an aged person dies. These indicators might not all show up at once or always be readily apparent. Once you begin to observe these changes, though, it is abundantly evident that the body is getting ready for its last shift. Many families find these adjustments challenging to embrace. Naturally, one wants to oppose them, to inspire a loved one to eat more, move more, or push through tiredness. Still, occasionally the greatest thing we can do is pay attention to the signs the body sends. We should concentrate on making their last time as pleasant, comfortable, and meaningful as possible, rather than on trying to undo the unavoidable. Knowing these indicators is more about becoming ready for death than it is fearing it. Early recognition of these changes will help us to provide better care, make wise decisions, and guarantee that the last months of our loved one are blessed with love, dignity, and respect. This is the time to treasure every moment, tell tales, and let them know they are not alone, but rather treasured. Take a long breath, and keep in mind that you are not travelling this road alone if you are observing these indicators in someone close to you. Many families have followed this road before. While it's never easy, knowing what to anticipate can help you find courage, patience, and calm. We value your joining us today. We would be happy to hear from you. Leave a comment below and indicate one item you discovered in this video and how you intend to use it in your own life. We value your opinions, hence kindly do not hesitate to share. Reading your comments motivates us to keep producing for you useful, inspirational material. Should you find this video helpful, be sure to like, subscribe, and forward it to others. Your contribution enables us to keep offering excellent material meant to enlighten and motivate individuals just like you. Thank you one more for seeing. We eagerly await seeing you in the upcoming video.